Module Overview. To ensure that healthcare organizations not only implement privacy and security policies, but also demonstrate active accountability, traceability, and ethical stewardship of data. This module covers the principles, practices, and frameworks involved in creating transparent, auditable, and ethically sound data governance models that comply with GDPR, UK Data Protection Act, ISO/IEC 27701, and HIPAA standards. As healthcare systems grow in complexity, the burden of ethical and legal compliance cannot rest solely on automated safeguards or abstract policies. Instead, it must be actively enforced through auditable actions, documented responsibilities, verified compliance structures, ethical leadership, and culture. This module provides a panoramic look into how data governance is designed, implemented, and monitored in clinical, administrative, and research settings. We explore how digital audit trails, access logs, internal investigations, third-party oversight, and organizational ethics boards work together to uphold data protection in practice, not just on paper. 1. The principle of accountability under GDPR. GDPR Article 5(2). The controller shall be responsible for and be able to demonstrate compliance with Paragraph 1, accountability. This means organizations must not only comply with data protection rules, but also prove that they comply. Documentation, evidence, and audits are key. Elements of accountability: appointing a data protection officer, DPO, conducting data protection impact assessments, DPIAS, maintaining processing records, Article 30, regular training and awareness campaigns, incident documentation, and breach logs. 2. Audit trails. Transparency through technology. Definition: audit trails are system-generated records that track every interaction with personal health data, what was accessed, when, by whom, and for what purpose. Use cases: reviewing staff access to a patient's EHR, tracking edits or deletions of diagnostic data, identifying suspicious or unauthorized data retrieval. Key features: immutable time-stamped logs, automatic flagging of irregular behavior, multi-layer access hierarchy, real-time monitoring via dashboards. Tools: SIEM systems, e.g., Splunk, IBM Cradar, EHR logging systems, Epic, Cerner, Meditech, blockchain for tamper-evident audits. 3. Accountability mechanisms in practice. Policy-level measures: clear, written data protection policies, separation of duties, e.g., clinical versus IT access, regular internal audits and compliance reviews, operational measures, role-based access control, RBAC, automated policy enforcement in software consent tracking integrated into patient portals, human factors, designation of data, custodians, confidentiality clauses in staff contracts, ethical leadership from department heads. 4. Ethical data governance in healthcare. Definition: data governance is not just about legal compliance. It also requires ethical decision-making regarding how data is collected, used, shared, and retained. Core principles: stewardship, respecting the data entrusted to you. Transparency, informing patients of data practices. Justice, avoiding discriminatory or exploitative use of data. Beneficence, ensuring patient welfare remains the top priority. Oversight models. Ethics review boards for data use, data governance councils with cross-functional representation, public advisory panels to review data sharing practices. 5. Breach reporting and organizational accountability. Breach handling process. Identification of a suspected or actual breach. Documentation in an internal breach register. Notification to supervisory authority within 72 hours, GDPR Article 33. Notification to data subjects if there's high risk, Article 34. Root cause analysis and mitigation plan, consequences of poor accountability, fines up to 20 million euros or 4% of global turnover under GDPR, loss of public trust, legal liability in malpractice or negligence suits, license revocation for serious ethical violations. 6. Comparative accountability in GDPR, HIPAA, and FIPA 1. Standard 2. Accountability Feature 3. Examples: GDPR DPIAs, DPOs, records of processing ICO audits. HIPAA covered entity responsibility, privacy officer roles. FIPA custodian duties and logging, Ontario health breach rules. 7. Real-world case study, NHS digital access breach. Incident: junior staff accessed the health records of a celebrity without legitimate reason. The system detected it via audit trail review. Internal investigation triggered. ICO fined NHS Trust £180,000 for failing to restrict access. Retraining and updated access protocols introduced. 8. Measuring ethical maturity and governance health. Tools: data ethics frameworks. Maturity models, e.g., CMMI for data governance. Ethics KPIs, e.g., percent of access reviewed quarterly. Continuous improvement. Lessons learned from each breach or near-miss internal whistleblower protection channels. External ethical certification programs, e.g., CPD accredited ethics units.